Welcome to the Cenario Podcast, your guide to mental health and well-being. Each episode, we uncover practical tools, discuss expert insights, and explore how supplements can transform your mental health journey. Get ready to learn, grow, and thrive with us.
Okay, so have you ever just felt like completely wiped out? Like no matter how much sleep you get, you're just dragging.
Oh, yeah, absolutely. I think we've all been there.
Right, or maybe like the numbers on the scale are suddenly doing something totally unexpected. Or, I don't know, maybe even like your skin's looking a little different. It's easy to just brush these things off, right? Like, it's just stress or that's getting older.
Yeah, it's easy to just chalk it up to something else. But sometimes it could be something more, right?
Exactly. And that's kind of what we're going to dig into today. We're talking about Addison's disease. You might also hear it called primary adrenal insufficiency.
Okay.
So, to put it simply, it means your adrenal glands, those are those little organs that sit off top of your kidneys. They're not producing enough of certain hormones, mainly cortisol and aldosterone. What are these hormones? What do they do?
So cortisol, think of it as like your energy manager, your stress handler. It even plays a part in your immune system.
Wow.
Aldosterone, that one's more about keeping the blood pressure stable and making sure you've got the right balance of like sodium and potassium.
So if those levels are off, it's like things start to go haywire.
Pretty much, yeah. And the thing is, these glands, they don't just work on their own.
Right.
They're constantly talking to your pituitary gland up in the brain and the hypothalamus. It's like a whole feedback loop.
A system, yeah.
Yeah, a system. So if one part's not working right, like the adrenos and Addisons, the whole thing can get thrown off.
And this isn't just about feeling a bit tired, right? From what we've got here, this is a pretty serious condition.
Yeah, it definitely is. And it needs treatment, lifelong treatment, to manage it. If it's not treated or if those hormone levels suddenly crash, it can be life-threatening.
We're talking like adrenal crisis, right? So for this deep dive, we've got some really good info on Addison's disease. We'll be talking about the symptoms, the causes, the treatments, the whole thing. We want to break this down for you so you know what to look for, what it all means, and what you can do.
Knowledge is power, right?
Exactly, exactly. So first things first, let's talk about symptoms. One thing that really stands out from what we've got here is that the symptoms, they tend to develop gradually.
Yeah, that's one of the tricky things about it. It's not like you wake up one day and boom, you have Addison's. It's more like this slow buildup of different things.
And that makes it easy to miss, right?
Yeah. You might think, oh, I'm just tired because I'm working too much or, it's just getting older. But then it just keeps getting worse.
And speaking of tired, that seems to be like the big one here. Chronic fatigue.
Yeah, our source calls it one of the most persistent symptoms.
Persistent. Yeah, it's a key word there. This isn't just, oh, I had a long day, I need a nap. This is like bone-deep exhaustion all the time.
Exactly. It doesn't go away with rest. It hangs on.
Oh, that sounds awful. And then you've also got muscle weakness.
Yeah, that's another big one. And it can get worse over time to the point where it's hard to, move around, do your normal activities.
And then there's weight loss and appetite changes.
Right. And it's not intentional weight loss. It's just happening because your hormones are out of whack and you might not even feel hungry.
Yeah, like your body's just not regulating things properly anymore.
Exactly. And all of this, it can even affect your blood pressure. We're talking low blood pressure or hypertension. So you might feel dizzy, lightheaded, maybe even faint.
And this next one, it's kind of a telltale sign, isn't it?
Yeah, this one's pretty unique to Addison's skin darkening. Hyperpigmentation.
Yeah, that one.
It's not like a tan, it's more patchy. You might see it on spars or your knuckles. Even your gums can get darker.
So how does that even happen?
Well, remember how we talked about those glands talking to each other?
Yeah.
So when your adrenals aren't making enough cortisol, your pituitary gland tries to kick things into gear.
Okay.
It starts pumping out more of this hormone called ACTH, which is supposed to tell your adrenals to make more cortisol.
Right.
But the problem is ACTH also triggers the production of melanin, which is what gives your skin its color. So more ACTH, more melanin, darker skin.
Wow, that's fascinating. It all comes back to that feedback loop.
Yeah, it's all connected.
And then I also remember reading about salt cravings.
Oh, yeah, that one's a classic.
That seems pretty specific, right?
It is, and it's directly related to the aldosterone deficiency. Aldosterone helps your body hold on to sodium. So when you're low on aldosterone, you start craving salt like crazy.
Interesting. So you're literally losing sodium, and your body's like, hey, we need more of that.
Exactly. And then there's low blood sugar, hypoglycemia, though it seems like that's more common with secondary adrenal insufficiency.
Right, so that's when the problem is with the pituitary gland, not the adrenals themselves. And it's not just physical stuff either, right? You can have digestive issues, mood swings, even problems with your menstrual cycle or libido.
Yeah, all of that. Hormones, they really affect everything. Nausea, vomiting, stomach pain, diarrhea, you name it. And then, yeah, mood swings, anxiety, depression, irritability.
It's amazing how much those little glands can mess with your whole system.
Yeah, it is. And then there's the big one, the one you really need to watch out for, adrenal crisis.
Yeah, this is like a medical emergency, right?
Absolutely. It's when your hormone levels just plummet suddenly and drastically. You get extreme weakness, confusion, severe pain, vomiting. You can even go into shock.
That sounds terrifying.
It is. It's basically your body shutting down.
So if that happens, you need to get to a hospital immediately.
Immediately. No question.
Okay, so we've talked about the symptoms, but what causes all of this in the first place? Like, why do the adrenal glands just stop working?
Well, there are a few different reasons. The most common one, though, is autoimmune disease.
So that's when your own immune system attacks your body, right?
Exactly. It's like your immune system gets confused and starts seeing your adrenal glands as the enemy. It's called autoimmune adrenalitis.
And that can just destroy the glands?
Yeah, it can damage them to the point where they can't function properly anymore.
So what else can cause Addison's?
Well, infection can do it. Things like tuberculosis, HIV, or certain fungal infections.
Okay.
Those can damage the adrenal glands directly. And then there are also genetic disorders. Some people are just born with conditions that affect their adrenal function.
And then we also mentioned secondary adrenal insufficiency, where the problem is with the pituitary gland.
Right. So remember, the pituitary gland makes ACTH, which tells the adrenals to make cortisol. If the pituitary gland is messed up, maybe from a tumor or an injury or some kind of disease, it can't make enough ACTH. And then the adrenals don't get the signal to make cortisol.
Got it. So it's not the adrenals themselves, it's the messenger that's broken.
Exactly.
And then there's also tertiary adrenal insufficiency.
Right. That one's all about the hypothalamus. That's another part of the brain. And it basically tells the pituitary gland what to do.
Okay.
So if the hypothalamus isn't working right, the whole chain of command breaks down.
And that can happen if you suddenly stop taking certain medications, right? Like long-term corticosteroids.
Yeah, that's one of the most common causes. When you take corticosteroids for a long time, your body gets used to having them around and it stops making its own cortisol. Then, if you stop those meds abruptly, your hypothalamus and pituitary gland are like, wait, what? We need to start working again.
But they can't just kick back into gear immediately, right?
Right. It takes time.
And that's when you can have problems.
Exactly.
And then finally, you can also have Addison's if your adrenal glands are damaged directly, like if you have surgery or an injury.
Right. If the glands themselves are gone or they're too damaged to work, then you're not going to have those hormones.
Okay, so let's say you're experiencing some of these symptoms. How do you even know if it's Addison's? How is it diagnosed?
Well, it starts with talking to your doctor, obviously. They'll ask you about your symptoms, your medical history, all of that.
Right.
And then they'll probably run some blood tests. They'll check your levels of cortisol, aldosterone, sodium, potassium, all the things we've been talking about.
Okay.
And then there's a test called an ACTH stimulation test.
What is that?
Basically, they give you a shot of synthetic ACTH, and then they see how your adrenal glands respond.
Interesting.
Yeah, it's a way to see if your adrenals are even capable of making cortisol.
Got it.
And they might also do some imaging tests, like a CT scan or an MRI, that lets them look at your adrenal glands directly and see if there's anything weird going on.
Okay, so once you got a diagnosis, what happens then? How is it treated?
Well, the main thing is hormone replacement therapy. You need to replace those missing hormones.
Right. Makes sense.
So for cortisol, you'll probably be on something like hydrocortisone, prednisone, or dexamethasone. And the dosage, it might need to be adjusted from time to time, especially if you get sick or if you're under a lot of stress or if you're having surgery.
Okay.
And then for aldosterone deficiency, there's a medication called fludrocortisone acetate that helps with the blood pressure and sodium balance. You might also need to increase your salt intake a bit.
And I also saw something about calcium and vitamin D supplements.
Yeah, those are important. Taking corticosteroids long-term can sometimes weaken your bones, so calcium and vitamin D can help protect them.
Okay, that's good to know. And then there's also the emergency plan, right, in case of an adrenal crisis.
Absolutely. Everyone with Addison's should have a plan in place. That means wearing a medical ID bracelet or necklace so people know you have the condition, and have emergency corticosteroid injections on hand, just in case.
Yeah, because if you have a crisis, you need to be able to act fast.
Exactly.
So it sounds like medication is really the cornerstone of treatment, right? But does lifestyle play a role too?
Oh, absolutely. Medication is crucial, but lifestyle choices definitely make a difference.
Like what?
Well, managing stress is huge. Stress can really mess with your cortisol levels.
Yeah, that makes sense.
So things like yoga, meditation, deep breathing exercises, those can all be really helpful.
Anything to keep those stress levels down.
Right. And then your diet. Eating a
Mhm.
balanced diet is super important. Make sure you're getting enough sodium, protein, healthy fats.
Like what kind of fats?
Things like avocados, nuts, olive oil, those are all good for hormone balance.
Okay.
And then there are certain things you want to avoid, like caffeine and alcohol. Those can overstimulate your adrenal glands and make things worse.
Right.
And then refined sugars and processed foods, those can cause your blood sugar to spike and crash, which isn't good for anyone, but especially not for people with Addison's.
So basically just focus on eating whole, unprocessed foods.
Exactly. Lots of fruits, vegetables, lean protein, healthy fats.
Okay. And what about supplements? Do those play a role?
They can. Things like vitamin C or B vitamins can be helpful for adrenal support. And there are certain herbs like ashwagandha and rhodiola that some people find beneficial.
Right.
But it's really important to talk to your doctor before you start taking any supplements.
Right, because they could interact with your medication.
Exactly.
Okay, so we've covered a lot. We've talked about symptoms, causes, diagnosis, treatment, lifestyle.
Yeah, we've pretty much gone through the whole thing.
What about complications? Are there any long-term risks with Addison's?
Well, the biggest one is adrenal crisis, which we already talked about. But even with treatment, there can be other challenges, like chronic fatigue and muscle weakness. Those can sometimes linger.
Even if you're taking your medication.
Yeah, sometimes. And then there's the low blood pressure and the risk of going into shock. That's always a concern.
Right.
And then there are mental health issues, anxiety, depression, mood swings. Those can be really tough to deal with.
Yeah, that's understandable.
And then, as we mentioned before, long-term corticosteroid use can increase your risk of osteoporosis.
So it's not just about taking a pill and everything's fine. It's a lot more complicated than that.
Right. It's about managing a chronic condition. It takes effort, but it's definitely manageable.
So to sum it all up, Addison's disease is a condition where your adrenal glands don't produce enough of those crucial hormones like cortisol and aldosterone.
Right.
And they can lead to a whole bunch of symptoms, from fatigue and weakness to changes in your skin and blood pressure.
Uh-huh.
The most common cause is your immune system attacking your own adrenal glands. And getting diagnosed involves blood tests, stimulation tests, maybe even some imaging.
Yep.
And the treatment, well, it's lifelong. You're going to be taking medication to replace those missing hormones. But lifestyle choices, like managing stress and eating a healthy diet, those are really important too.
Absolutely.
Early diagnosis and consistent management, those are the keys to preventing serious complications and living a full, healthy life with Addison's.
Couldn't have said it better myself.
So we've thrown a lot of information at you today, but hopefully it's given you a better understanding of this condition. And it really makes you think, right? About how all the systems in our bodies are connected and how something that seems minor, like just feeling tired all the time, could actually be a sign of something more serious.
Yeah, it's definitely worth paying attention to those little signals your body sends you.
Exactly. So if anything we've talked about today rings a bell for you, if you're experiencing any of these symptoms, please talk to your doctor. Don't ignore it.
Get it checked out.
It's always better to be safe than sorry. And, the more you know about your health, the better equipped you are to advocate for yourself.
That's the truth.
So stay informed, stay curious, and most importantly, take care of yourselves.
And we'll see you next time for another deep dive.
See you then.
Thanks for tuning in to the Cenario podcast. Don't forget to visit Cenario.com for more expert tips, articles, and supplements designed to support your mental health. If you enjoyed this episode, remember to subscribe and share it with a friend. Until next time, take care of yourself.